Yes, Lyme disease exists in the South. It's time to rethink what we assume about tick-borne illnesses. I had a patient from Florida who said, "But Lyme disease doesn't exist down here, right?" She had a rash, fatigue, joint pain, classic Lyme symptoms, but the doctor told her she had STARI instead of testing for Lyme disease. Now, STARI is Southern Tick-Associated Rash Illness, which was coined by doctors who work with Lyme disease. They thought it was related to a different tick, and the tick was the Lone Star tick. And it hasn't been studied that much. They thought there was no chronic illnesses. Of course, the researchers were in the Northeast where they weren't following these patients anyway. But STARI really doesn't have a great understanding, a great test. It's just more of a rash. But if it's actually Lyme disease, if you mislabel it and don't treat for Lyme disease, don't assess for Lyme disease, you might end up with acute and chronic Lyme disease manifestations. So Lyme disease is often dismissed in the South. There was a study in BMC Infectious Disease journal where they investigated patients in the southern U.S. with Lyme-like symptoms. So those patients are there. They found the Borrelia burgdorferi DNA in the blood and skin. Why this matters is that Lyme disease is not limited to the Northeast. Southern ticks can carry Lyme disease bacteria, and Lyme-like illnesses happening in the South. Now, the diagnostic barriers in the South is that there are some doctors that aren't trained to recognize Lyme disease in the South. Tests are optimized for the type of ticks we have in the Northeast, the strains that are in the Northeast. And of course, there's different strains in different parts of the world. The symptoms might be dismissed or misdiagnosed. Some people may have both. Some people may have both, STARI and Lyme disease, or a co-infection. So what you should know, Lyme disease is not a northern-only illness. In fact, it's all over the country and the world. Southern ticks deserve full evaluation. Now, if you find yourself in denial, or someone who is in denial, is that sometimes you might miss or delay a diagnosis. The conclusion is Lyme disease does not respect state lines. One of the problems is that birds carry the ticks to Canada and back to the feeding grounds in south. So any area that doesn't think they have ticks have been found to have ticks if they look. And so it's a problem that we need to have awareness, not just in the Northeast where we first observed it, but also in the South. So this is the reference by Clark titled Detection of Borrelia burgdorferi sensulato, DNA in patients with symptoms consistent with Lyme disease in the southern United States. This is 2013. Appreciate you being with me for this Common Sense Lyme series. Thank you for joining me.